Hello, welcome back to our channel Magic of Medicine. Today we are talking about a condition that many people have heard of but don't know much about, that is testicular microlithiasis. What is it? Should you be worried about it, and what does it mean for the health? Let's dive in. So, first of all, coming to the definition of testicular microlithiasis. So, as the name suggests, there are microliths within the testicular parenchyma. Micro means tiny, very tiny. What we considered in our criteria is less than or equal to 2 to 3 mm. And lithiasis means calcification. So now our definition is clear. Now coming to the pathophysiology. Why do these liths get deposited in the parenchyma? So these liths are nothing but the calcifications in seminiferous tubules. These are calcified collagenous material deposited in seminiferous tubules. So testicular microlithiasis is a marker of tubular degeneration. So what is happening is, look, this is seminiferous tubule. This is its epithelium. In individuals in whom the tubules starts getting degenerated, this epithelium starts getting shed off and some collagenous material starts getting deposited. These together later on gets calcified and are seen as testicular microliths. So testicular microliths, now you know, is nothing but calcification in seminiferous tubules. Okay. Now coming to the risk factors or causative factors of testicular microlithiasis. These risk factors are what? These risk factors are the risk factors of seminiferous tubules getting degenerated. So I have made two mnemonics for you. One is pudding and second is male duckling, which is seen in next slide. So pudding is P for pseudohermaphroditism, U for undescended testes, D for Downs, I for infertility and infarct, N for normal testes and neoplasm, G for granulomatous disease, and K is a accessory risk factor which you have to remember separately in this mnemonic, which is Klinefelter syndrome. Next mnemonic is male duckling. So male stands for male pseudohermaphroditism and AL for alveolar microlithiasis. Again, D stands for Down syndrome, U for UDT, C for cryptorchidism, K for Klinefelter, I for infertility and infarct, N for normal testes and neoplasm, and G for granulomatous disease. So now whenever you are asked about testicular microlithiasis, remember either of these two mnemonic. One is male duckling and second one, or you can remember, is pudding. So you can remember male duckling has testicular microlithiasis. Now coming to the clinical features. So we know that it is usually diagnosed incidentally. It is asymptomatic. So most people with testicular microlithiasis have zero symptoms. It's usually discovered by accident during an ultrasound for something else like testicular pain or a fertility checkup. However, it is associated with infertility and malignancy. And it can be also associated with alveolar microlithiasis and CNS lithiasis. What happens is, microliths can also be seen in extratesticular structures as well, such as lungs and CNS. Mutation in SLC34A2 gene 4p15 has been found to occur in patients with pulmonary alveolar microlithiasis and some patients of testicular microliths. So you have to remember this gene thoroughly. Now this is a question, so we will read more about it. What happens is whenever the SLC34A2 gene and 4p15 chromosome mutation occurs, there is inactivity in sodium dependent phosphate transporter, which leads to non-clearance of phosphate, which leads to phosphate deposition in alveoli, and phosphate in turn attracts the calcium, and ultimately we have calcium phosphate crystals deposited in alveoli, which is an entity called alveolar microlithiasis. Now, whenever you have a question of alveolar microlithiasis, you need to remember this gene, SLC34A2 gene. Now coming to the USG features. So on USG, since we know these are microliths, these will be less than or equal to 2 to 3 mm, and these will be non-shadowing hyperechoic foci. In these, the comet tail artifacts may be seen. There will be, remember, no posteroacoustic shadowing, however, comet tail artifacts may be seen. Next, what is the location? So more often they are scattered randomly in the testis and very less likely they are clustered. And this clustering is a warning sign. If you see a clustering of microlithiasis, it is more likely to be a malignancy. Next, these microlithiasis can be unilateral or bilateral, and whenever bilateral they are usually asymmetrical. So more often they are bilateral only, remember. Then we will know about ESUR classification. ESUR has classified testicular microlithiasis into 3 types. First is classic. Classic is when at least 5 microliths are present per field of view. Limited microlithiasis is less than 5 microliths per field of view, and diffuse microlithiasis is numerous microlithiasis, that is snowstorm appearance of microlithiasis. So there are 3 types of testicular microlithiasis: classic, limited and diffuse. Remember this figure 5. Classic is 5 or more than 5, limited is less than 5, and diffuse is numerous or snowstorm microlithiasis. Now, special attention should be paid to clustering. So this is a warning feature. A cluster of microliths is more worrying than scattered microliths throughout the testis. It may indicate a dysgenic area in testis in which carcinoma in situ may develop. So remember, look for any clustering. If it is present, it may be the indicator of carcinoma in situ. Now coming to the USG picture. Look, this is how you will see testicular microliths. You can see these punctate, hyperechoic, non-shadowing foci scattered randomly throughout testis. Here we see a case of diffuse bilateral testicular microlithiasis. Again, this is another case. You can see the multiple punctate, hyperechoic foci. These are testicular microlithiasis scattered randomly in bilateral testicular parenchyma. Now, coming to the risk factors that need follow-up of patients with TM. These risk factors are as per ESUR and EAU guidelines. We know that mostly testicular microliths are leave-alone lesions. However, if any risk factor is present, we need to follow up the patients. So, there are 5 risk factors. First is previous germ cell tumor or history of germ cell tumor in first degree relative, like father, brother. Then history of undescended testis, history of orchidopexy. So remember these two as one and these two as one thing, UDT and orchidopexy. And fifth one is testicular atrophy. And what is testicular atrophy? A volume of less than 12 ml is testicular atrophy. Normal volume of testis should be around 18 ml. If it is less than 12 ml, sorry, if it is less than 12 ml, it is testicular atrophy, and it is a risk factor of carcinoma. The follow-up for patient with TM is recommended up to the age of 55 years. So, whenever you are asked, is testicular microlithiasis is linked to testicular cancer, the answer is maybe, because the patients are quite concerned now. So some studies suggest that there's a connection, especially if you already have another risk factors like a family history or previous testicular cryptorchidism, orchidopexy, or atrophy of testis. However, the risk remains low and no treatment is needed unless other concerns are present. But yes, in these risk factors, if these 5 risk factors are present, you need to follow this patient up to the age of 55 years. So remember, 5 is the magic number for microlithiasis. The definition has less than 5 and more than 5 per field of view as per classic and limited testicular microlithiasis are concerned, and age of follow-up is also 55 years, which also has a magic number of 5. Risk factors are also 5 here. Now, the presence of testicular microlithiasis alone without any coexistence risk factors neither requires a regular scrotal ultrasound nor requires any biopsy. However, we can advise a monthly testicular self-examination to these patients, and we will ask them to immediately consult the doctor if they find any pain, lump, or swelling in the testicular self-examination. Now, thank you for watching the video. If you liked the video and found it useful, please like, share and subscribe.